Pharmacology is the study of drugs and their interactions with living organisms, aiming to understand their effects, mechanisms of action, and optimal dosing regimens. One crucial concept in pharmacology is the area under the curve, AUC. AUC refers to the area under the concentration time curve, which graphically represents the drug concentration in the body over time after administration. This essay will delve into the importance of AUC in pharmacology and its applications in drug development, dosing, and therapeutic monitoring. Understanding AUC. In pharmacokinetics, the study of drug disposition in the body, the AUC is a vital parameter that quantifies the total drug exposure over time. The concentration time curve typically results from drug concentration measurements at different time points after administration. AUC is calculated using mathematical integration techniques, such as the trapezoidal rule or the Simpson's rule. AUC and drug absorption. AUC plays a significant role in understanding drug absorption, particularly when drugs are administered through different routes such as oral, intravenous, or transdermal. It helps pharmacologists and researchers determine the extent of drug absorption into the systemic circulation, which is critical for drug bioavailability assessments. AUC also aids in comparing the efficiency of different formulations of the same drug. AUC and drug elimination. For drugs to exert their effects, they must be eliminated from the body eventually. AUC also provides insights into drug elimination and clearance. By comparing the AUC values of different drugs or formulations, pharmacologists can assess their pharmacokinetic properties and select the most suitable drug candidates for further development. AUC and dosing regimens. Optimizing dosing regimens is crucial in pharmacology to achieve the desired therapeutic effects while minimizing side effects. AUC helps in designing appropriate dosing schedules by providing information about the drug's concentration time profile. The goal is often to maintain drug concentrations within the therapeutic window, where efficacy is maximized and toxicity is minimized. AUC and drug efficacy. The AUC is closely linked to a drug's efficacy, as it reflects the total exposure of the drug to the target site over time. Pharmacologists use the AUC to establish the concentration required for a drug to produce the desired therapeutic effect. A larger AUC typically corresponds to a stronger pharmacological effect, but excessive AUC might lead to adverse effects. AUC and therapeutic drug monitoring, TDM. Therapeutic drug monitoring, TDM, is a practice where drug concentrations in a patient's blood are regularly monitored to ensure that they remain within the therapeutic range. AUC is a crucial parameter in TDM, especially for drugs with a narrow therapeutic index, where small changes in drug concentration can lead to inadequate or toxic effects. By measuring AUC in individual patients, clinicians can adjust drug dosages to achieve optimal therapeutic outcomes. AUC and bioequivalence studies. When a drug has multiple formulations, example generic versions, bioequivalence studies are conducted to ensure that different formulations produce similar drug exposure in the body. AUC is a primary pharmacokinetic parameter used in these studies to demonstrate bioequivalence. Conclusion. The concept of area under the curve, AUC, is an essential aspect of pharmacology and pharmacokinetics. It provides valuable information about drug absorption, distribution, metabolism, and elimination. Understanding AUC is crucial in drug development, dosing regimens, and therapeutic drug monitoring. By considering AUC, pharmacologists can optimize drug efficacy, minimize side effects, and ensure the safety and effectiveness of pharmacological interventions. As pharmaceutical research continues to advance, AUC will remain a fundamental tool for assessing drug pharmacokinetics and shaping the future of pharmacology.